Good afternoon, everyone. We are 2 minutes past the hour. So in the interest of time, we'll go ahead and get started. My name is Desmond Banks. I'm a clinical assistant professor here at Boise State University. I also have the luxury and privilege of being the chair of our continuing education committee. All of our sessions are excellent, but we are really in for a treat today. We have a Boise State alum, Ms. Corey Surber, who is going to present to you today on just that could not be a more important time with our Idaho State Legislative session starting this past week and our presidential inauguration coming next week. Is what better time to talk about how to engage political stakeholders. So with that, without further ado, I'll turn it over to our presenter, Ms. Corey Surber, to go ahead and introduce herself and to get started. Thank you.
Thanks, Desmond. Can you hear me all right?
Yes,
you
we
give
can.
me the thumbs up.
We got you.
All right. Well, I'm really pleased to be with you all today and to have the invitation to address this group. I'm going to see if I can pull up the slides and share them with you all. All right. Are you able to see the slides?
We are.
Yes, thanks.
Okay. I will launch into it. All right. So my background, I'll share a little bit on that. So I have worked with the St. Alphonsus health system for 32 years now. And if you're asking if I started working there when I was 10, the answer is I wish. About 21 years of that time has been serving in an advocacy government affairs function. And currently I have the advocacy function for the Idaho and Oregon region of our national health system. Among my colleagues across our national system, I sort of, I don't know, brag and complain that I have the region that's the most politically opposite between the two states, having Idaho and Oregon. And when we get, more and more extreme in either direction, it creates challenges for health policy. I have had the opportunity to serve on a number of nonprofit boards and then also professional associations and still serve on some of those. So you can see those here. And then as you can see in my background, what recharges my batteries from working in politics all the time is getting out where there's no cell phone service and taking pictures of scenery and wildlife that I come across. And so I've currently got stuff on my wall from a trip to Africa last year. So I think it's important for all of us in this challenge, if we're engaging in advocacy, just knowing how stressful, draining, all in it just, can take over and negatively affect our own resilience. So I've really had to learn the hard way after ending up in the emergency department, suffering from an anxiety episode that manifested like cardiac issues. I learned that you really have to balance yourself out and do what you need to do to care for yourself as you are putting yourself out there to make efforts on behalf of those that we serve. So we'll start with why even get involved? Why even, bother to advocate? Sometimes it may feel pointless. It may feel like one person's voice doesn't matter, or even a whole group of people's voices might not matter. But it really comes down to what we're giving up if we don't. We need to engage when we see problems that need solving, because believe it or not, and it can feel discouraging at times, but progress is made, sometimes very incrementally. But when a problem needs solved, it takes people that really care to get in there and engage. So, I share this sentiment with my students in the nursing program that, sometimes politics can be a real turnoff to people uh, whether they're serving in healthcare or in public health capacities. But I would say that they have what it takes to really engage and be effective at it in terms of the respect that people have for people in healthcare, and I would say in public health. I think public health has taken a beating in the past few years, but we are, particularly skilled at being able to break down an issue, really analyze it. We can understand the dynamics around the people involved and the dynamics there. And we are relationship builders. And when it comes right down to it, advocacy is far more effective when there's a relationship there in the first place before you go and ask a policymaker for something. Political analysis itself is basically the art of breaking down an issue, understanding all of the driving factors behind it, who the key players are. The steps to political analysis start with that, really taking a hard look at the issue, including how long has this been an issue, how many people does it affect, and how badly does it affect those folks? Is it time constrained, or is it an ongoing kind of protracted problem? Do we need an immediate solution, or is it something that we're just trying to make gains in over time? What is the risk of doing nothing? We need to understand the context that this issue is sitting within. If we want to use our current political situation as an example, we need to understand the changing dynamics of the political environment. If it's a federal issue, we need to understand that we're going into a time frame when there will be one party in control of the White House, both chambers of Congress, and to some extent the Supreme Court having a conservative majority there. You need to understand the context you're working within, what the history of that particular issue has been, what some of the root causes are, where there have been gains, where there have been setbacks. The context is very important. You need to then go about doing a deep dive on political feasibility. If this is something that really needs to be done, we need to look at the driving factors in our favor, in the favor of getting things done, and those factors that are opposing us. And our next slide, I'll show you a quick exercise that I run coalitions through when we're doing that step. We need to look at who the stakeholders are on each side of the issue so that you can kind of look at what the balance of power looks like. You need to look at what resources are going to be needed if you're going to try to drive that issue forward, both in terms of the people, your capacity in terms of grassroots support, grass top support, leaders who might be willing to speak out publicly on an issue, financial resources that you might need to do both policymaker education and maybe public education if you need the public to speak out on an issue. You do need to look at the values that are involved in that particular issue. The example that pops right to my mind when I think of a values assessment is tobacco policy that I've worked on. Worked deeply on the process where we worked on trying to raise the legal sale age for tobacco products from 18 to 21. And, the values that butted up against that around freedom. And freedom has been a value that has, and self-determination, those have come up against some, other policies we've worked on as well around, like trauma prevention, trying to pass helmet laws, things like that, immunization policy. Values are a big issue there. You can bring all the charts and graphs and data and science that you want, but they're going to confront the values that are at play. And then really look at what your proposed solutions are, what your, ultimate goal is, and what are you thinking in terms of a first year goal, and then maybe look 3 to 5 years out, just recognizing that not everything is possible to complete in a year. So this is that political feasibility tool that I was referring to. Usually do this on flip charts or whiteboards where you might get everybody to brainstorm what are the forces that are in our favor if we're trying to make a policy change. Using the tobacco policy as an example, boy, we could sure list a lot of organizations that were, in support, including public health organizations, healthcare organizations, nonprofits that are, kind of disease related, the disease groups. So the Cancer Society, the Lung Association. It seemed like we had a whole crowd of folks. We had science in our favor. We listed a whole lot of things that were in our favor. And then you go to list the opposing forces, the forces that are going to butt up against making that change. And it wasn't a long list on the other side, but it was an important list in terms of the tobacco companies having just a bottomless amount of money that they can throw at hiring up every lobbyist, putting out information, scaring legislators in terms of their political futures, that sort of thing. And so this kind of tool is important in terms of, listing out the reality of what's for us and what's against us, and having an honest conversation around how feasible it is to move forward. So once you've decided you're going to take action, you step through the process by, going through some of those steps I just laid out, and then starting to organize. I think every, big issue really requires a group, a coalition of folks that is kind of in agreement with what they are proposing as a solution, and staying on the same page with one another. So when you're organizing in a coalition, it's important to kind of bring everybody around the table and understand what each stakeholder's goal is, and also understand any parameters they would put around that, where their support would have to drop off if there was, a certain condition. An issue where this is definitely a factor is women's health policy right now, talking about Idaho's abortion law and changes that may need to be made. There are people around the table that their participation in that discussion hinges on, I work for a faith-based organization, so I can only participate in those discussions to a certain point, that involves the impacts to our providers who have never provided elective abortions, but are still impacted by their ability to provide care to pregnant women who wanted their pregnancy, but they end up with a pregnancy complication, and the care is complicated because of the policy. So you need to understand some of the limitations around, your coalition members and what they can bring to the table. Once it comes time to be communicating a unified message with policymakers, it's important to know most effective to least effective. So, most effective is when you've got existing relationships with elected officials that are going to be involved in the issue, and you can go to those key officials already having that relationship and say, hey, I'd like to talk to you about this particular issue we're working on, and get their honest feedback on, key people you should reach out to first, things to watch out for, context you might not have been aware of. I would say those personal conversations are the most effective. But I would also say the reality is that for some folks, making a phone call, sending an email may be the most realistic thing that you can do. And those also have a level of effectiveness in letting an elected official know how big an issue this is to the constituency that they serve. Um, Providing active testimony in a hearing is very effective. If you're able to do that, if a bill is up in a committee, I would say if you ever are in a position to testify in a committee, to make sure that you provide a written copy of that. More and more in our legislative committees, they're asking for a copy to so they can accurately include your comments in the public record. I cannot emphasize enough the importance of collective group strategies when you're trying to drive an issue forward. If all of the stakeholders involved were trying to advocate on these things on our own, we probably would have fragmented messaging. It would come off as each organization has its own stake in or is getting some benefit out of what's going on, what would happen if the policy were to advance. If we can go forward with one voice, we can be far more effective. I've been part of one particular coalition effort that where there was one member of the group who kind of decided to fragment off with their own message that would benefit their organization. And that can just torpedo the entire effort because then policymakers see weakness in the coalition's ability to stay together around a unified message. So I'm going to break down the distinction between lobbying and advocating as a citizen. So lobbying is, sort of more commonly associated with wining and dining legislators, contributing to their campaigns, that sort of thing. As I'm discussing lobbying, it is really trying to educate policymakers around an issue. If in our state legislature, our legislators are citizen legislators. Unless they're a committee chair or they're in leadership, they don't have staff to read up on these issues, to educate them. They rely on both lobbyists, who I would clarify are those who are advocating on behalf of an organization or some sort of a group. They're being paid to educate policymakers on an issue, paid to influence. A citizen advocate is somebody who is not educating legislators on behalf of anyone else. They're speaking out as a voter on their own behalf. They might also represent a group, but they're volunteering to do that. So it's important to acknowledge that both are important. That organizations sometimes have the resources to hire somebody to go speak and form the relationships. And the strength of having a lobbyist is they do form those relationships with policymakers, maybe on a broad scope of issues. So when they go talk to that policymaker, they already know them. Hopefully they trust them because they bring them credible information. And they can effectively kind of get across the organization's point of view. So what makes you an effective lobbyist or citizen advocate? First and foremost, it is how trustworthy are you that the information that you are providing to the policymaker is valid. Once your credibility is tarnished, that you provided, because in our Idaho legislature, with them being citizen advocates, sometimes they will hear something from a legislator or from a lobbyist. They will repeat that in their testimony, in their debate on the floor, whatnot. And if it is discovered that that is not correct, if it's not factual information, the person who gave them that information gets a bad reputation, because that lawmaker is sort of staking their reputation on the validity of the information that was provided to them. So it's very important to know your facts, do your homework, and only pass along what you know. To if a legislator asks you a question about the issue that you're working on and you don't know the answer, don't make it up. Don't be afraid to say, I don't have that information right now, but I'm going to look into that and I will get that to you later. Communicating clearly. I think it's important to recognize that many of our policymakers have no medical background. They don't understand our lingo. They don't understand our acronyms. And you need to make sure that you assess the audience that you are speaking to. If you're speaking to a committee, you got to think of kind of the lowest common denominator of if you are speaking to someone who might have been a farmer or a rancher as their background. They might be an insurance agent. They might, any profession, and they are in that profession the rest of the year when they're not in the Capitol. So you need to break things down to a level where it doesn't seem like you're talking down to them, doesn't seem like you're lecturing them, and just speak at a level that they can understand. Nurturing an ongoing relationship, just if you're able to do that, and it's most feasible to do that with the lawmakers that are in the district where you live. So probably the first most effective thing that you can do is find out who represents you in the district where you live and make an effort to learn more about them. When it's campaign season, they tend to do more town hall events and things like that. If you can go and meet these people that want to represent you, or the ones who get elected to represent you, so that they know you're one of their voters, they're going to listen to you. Because if somebody from another district reaches out to them, they may listen, but they're not going to be as inclined to do what's requested unless it's somebody in their district who they are accountable for. And then if they do something that you ask them to do, supporting legislation, stopping legislation that might be harmful, acknowledge that. And most of our legislators are on social media now. If you happen to be on social media, in addition to reaching out to them personally and thanking them for maybe making a tough vote, or voting the way that you requested, be sure to thank them in person. But boy, they sure do love public shout outs when it's good. I would caution against lighting somebody up when they vote against what you would like. But if it's good, it's always effective to kind of shout them out. It's important to know that nonprofits, there's a lot of confusion. Speaking on behalf of a nonprofit organization, there's perception out there in some nonprofits that they can't lobby. And that's not the case, but there are limitations. They can't endorse candidates. They cannot give from their organization to a campaign. I have candidates who reach out, often and want the support of St. Alphonsus. And I have to let them know, we are a nonprofit organization. We are not able to use organizational resources to support candidates. We can advocate on issues. That's what we are allowed to do. We cannot get involved in endorsing one side over the other. Now, we individually, so I have the ability personally to go participate in fundraisers if I want to, and that sort of thing. I can give from my personal resources to support a candidate. I will say, even though I have that ability, I use it very sparingly and carefully because I'm recognized as, somebody who represents an organization. And so it's just something to be aware of, just public perception, even if it's technically okay. And I will also add that public health agency staff, they're often restricted from, beyond the advocating on behalf of candidates. They often, they're not really able to advocate positions on issues unless they know it is consistent with the administration that they are working under, that sort of thing. So I will say that, like on the tobacco issue I was referring to, we had public health staff as part of that coalition, but it was more to inform us in terms of data they had around youth utilization of tobacco products. That, our public health experts are tremendously helpful in advising on policy, and give us the arguments that we need and make sure that you're keeping us honest. Anybody who lobbies on behalf of an organization has rules that they have to follow. And in Idaho, we have a requirement to register for every client we represent. So, I'm considered an in-house lobbyist because I'm an employee of the organization that I represent, and I have other responsibilities other than lobbying. But we also have an awful lot of contract lobbyists who that is all they do, and they may have a book of clients. Some of them have dozens of clients from different industries, and so they have to report publicly who they're representing, how much they spend. There are monthly and annual reports that all lobbyists have to file that that basically make it visible to the public how much money is going into advocating on particular legislation or regulation. So, and you as a citizen can go in and look this stuff up. And in recent years, we are seeing that there's a whole lot more out of state money coming into a lot of these issues. An example would be education choice legislation that's being considered. During the election, there was a tremendous amount of out of state money coming into Idaho, campaigning, for or against candidates based on their stance on education choice, education vouchers. So if you are, planning on actually meeting with public officials, and some of you may get the opportunity to sometime go to Washington, D.C. and meet with our members of Congress while you're there for a conference, or go down to the State House and meet with an elected official on an issue. I've kind of laid out some of the tips that I would advise. First of all, it's far more effective to make an appointment where you know that they have the time set aside for you. They often will ask for specifics about what are we going to be talking about and who is going to be in the meeting. Plan out what are we going to talk about, and make sure that you hit all the important points. If it's at the federal level, they most of the time are working in 15-minute increments. So you can think about, if you've got 15 minutes, what are the most important points you need to hit? Remembering to save time for a little relationship building. It's really helpful to kind of read up on that elected official before you go in to meet with them. And if you went to the same high school, or their wife, or there's something else that you can kind of build a little bit of a rapport with them, and it also helps them remember you. If you can kind of get to know them a little bit as a person outside of their position. So make sure you're introducing yourself, and whether you're there representing yourself or representing anyone else, what the main issue is that you're wanting to talk about. Give them specifics. If at all possible, share personal stories or examples. Those are the things that stick in their minds besides the facts and figures, those are great to have, but a lot of these things break down to emotional um, drivers behind a policy moving forward or not moving forward. Make sure that you have a very well thought out ask of them. If it's specific legislation, give them the bill number. If it's possible to give them an update on where the legislation is, if it's in a committee, if it's, maybe it's an issue that you want advanced, but legislation hasn't been introduced yet, let them know what the status of that issue is. And at the congressional level, they do have staff, and usually the staffer is in the meeting with you. The staffer might be the only one meeting with you if the elected official gets called to the floor to vote or something like that. I would also say you might be planning for a 15-minute meeting, but their alarm might go off on their clock on the wall that calls them to the floor to vote on an issue. And they only have a limited amount of time to leave their office building, go downstairs, take the little trolley across to the Capitol, get to the floor and make their vote. I have had a member of Congress, usually our Idaho delegation is really thoughtful about if we travel from Idaho to see them, they try to make time to see us in person. But I have had, Senator Crapo, for example, say, oh my gosh, I really want to meet with you, but I've been called to the floor to vote. Would you like to ride over to the Capitol with me? And so you might have 3 minutes instead of 15. So in your head, it's really helpful to plan out an elevator speech. If you were to have to condense your message and your request of them to a very short one, what would be the most important things to say? With my nursing students that I teach at Boise State, this is their final project, is preparing and recording an elevator speech, a 3-minute version of a Hill visit conversation. Building relationships cannot underemphasize or can't overemphasize it. And then be sure if they, raise objections to what you're talking about, or they, seem to just not be on the same page, be disrespectful. It's okay to push back, add additional information. I will say there's a member of our congressional delegation that when I first met him, I thought, man, this guy just does not, doesn't really care for my approach or me, or I don't know what it is, but he just seems argumentative. And I learned the same day that he's just somebody who likes to kind of banter on an issue as he's thinking through it, think about all, be devil's advocate on the issue. I was able to provide in that conversation a piece of information he didn't have about how the bill had changed. There was a piece in it that he wasn't a fan of. And I let him know at the end of the conversation that even if he disagreed, I was going to plan to be in the House gallery to watch the vote take place, and was hoping for his yes vote. And I figured that there was no way we had it, just based on how the conversation went. And when I went and watched the vote later that afternoon, when it got to him in the roll call, he looked around in the gallery, found me, pointed at me, and he voted aye. And that's probably one of the most gratifying experiences you can have, is to have a conversation with a policymaker, have a tough conversation where it maybe doesn't seem like they're on the same page, but you stay respectful, stay in it with the valid information that you have. And then sometimes they come around, and it's really gratifying when that happens. Some strategy advice that I would give you if you're looking to engage in advocacy is, first and foremost, remember the big picture. So we talked about context. Remember all the other things that are swirling, and your issue is just one little fish in the big swirl of everything else that's going on. Last year it was an election year, and so there were some things that you just know in an election year are going to come up in, every election year. There's going to be legislation around guns and abortion and everything that allows an elected official to go out on the campaign trail and say they voted this way or that way on these key issues. I would say this year the big dynamic is a huge paradigm shift in administration and direction from where we've been the past 4 years, and coming out of the pandemic. And all eyes are going to be on the federal administration to see, are they really going to do the things that they've said that they're planning to do? What are the new, agency heads going to advance, that sort of thing. So the context this year is kind of like watching at the federal level and also just understanding we've got single party in power. That is a big picture to be aware of. As far as communication, I'll talk a little bit about framing your message for the audience on a next slide. That's very important. Doing your homework. So on the issue that you're discussing with them, you need to kind of become the expert on that. Know as much as you can know about the issue itself and also the history of that issue in the public policy sphere. But remember, if you're asked a question that you don't have the answer to, be honest that you don't know the answer rather than guessing. Read between the lines and, look for agendas that might be out there. I would say one of the agendas the past 5 years has really been a view of science and evidence, facts, with a skeptical eye. I've had a policymaker say expertise is elitism. There really is much more of a populist feel in the Idaho legislature in particular, and so you need to carefully gauge where it's going to be useful to. And I don't think we should shy away from sharing what the scientific facts are around an issue, but I will say that sometimes, again, you have to know your audience, and being in a very conservative environment, it can be more effective if you take science and facts that come out of a state that's like Idaho politically. If the research was done in Utah or Arizona or Iowa, rather than California or New York. I mean, it's a sad reality, but it's a reality. Sometimes you're asked, where was this research done? And all it takes is finding out it's a liberal state where the university is, and there's a bias. It's important to be aware of the money involved in some of these issues. I used tobacco policy as an example. The importance of timing, that in a legislative session, a lot of these issues have been worked on since the last session ended, and you try to get them out early in the session so there's plenty of time for them to move through the process. But also be aware that at the end of the session, there is the ability for them to move issues they really want to move very quickly. I would say timing is also a factor this legislative session, because the new federal administration coming in is going to want to accomplish a lot in their first 100 days. So in our health system, we've actually made it an advocacy priority in this next 2-year session to just really be tuned into the first 100 days and everything that might, we may need to pay attention to in that first 100 days. We may have to activate very quickly. Keeping a united front, I talked about that in terms of coalition work, and then not burning bridges. When you're working an issue and you get personally invested in it, and that issue fails, I've been there more times than I care to talk about, but you can have a lot of emotions when something fails, or a policymaker you think that is with you ends up switching to the other side, and the issue goes down and you're very frustrated, you feel defeated. It can be tempting to fire off, an angry email, to go on social media and light somebody up, I would just highly encourage to go to happy hour with some friends instead. That's, a much more effective coping mechanism. Allow yourself to feel the feelings and to debrief and whatnot, but to burn bridges with a policymaker that you're probably going to have to engage the next year when you go back on that issue is not your best move. On message framing, my key issue here is when you're working an issue, again, you need to know your audience, and sometimes on the same issue, you might use different arguments for different audiences. So a big issue that I've worked on in the past 15 years has been Medicaid expansion. I chaired the governor's work group on Medicaid expansion, worked on advocating for it with the legislature just based on the work group's strong recommendation that Idaho should adopt Medicaid expansion. The legislature was not having it. It was part of Obamacare. They didn't like entitlement, spending and expansion of that to what they perceived to be able-bodied adults who should, provide insurance for themselves. Quickly discovered that there are some messages that just land better with a conservative audience on the same issue. So rather than leaning into the values of healthcare being a right, and that, we feel for those who are vulnerable populations who get left out, that it's damaging to hospitals, it was more effective to lean into Medicaid expansion, helping with Idaho's economy, because we would be spending less as a state on the safety net programs. We would have more healthy and productive workers in the state. Focusing on, some of the arguments on the right-hand side of the slide were far more valuable in getting, we managed to get Medicaid expansion out of committee with a recommendation. The problem was when it got to the floor, the speaker just did not want to put his caucus in the position of having to vote on that issue. So how do you start? Like, all this can be very intimidating and probably seems very in the weeds for somebody who might not want to get all that involved with advocacy, but might want to weigh in occasionally. So my starter recommendations for all of you is, first and foremost, to find out who represents you at the state and the federal level, and even the local level. Find out who represents you, because they work for you. You don't have to be intimidated about talking to them because they work for you. Remember that. And I can tell you, when I started my job, I was very intimidated at first because I thought, oh, these policymakers know everything, and I'm just coming in there a little whippersnapper that hasn't been doing this very long. I quickly found out kind of the gap in subject knowledge in the legislature, people in health and welfare committees who aren't healthcare providers. We only have one healthcare provider in the entire legislature, who's a nurse. Beyond that, you've got people making policy changes that affect public health and healthcare, who don't have that background. So kind of lean into the fact that you can help them, help beef up their expertise. Meet those who represent you, if at all possible. Try to develop a relationship. Stay informed on issues, and I can tell you, the Idaho Public Health Association has been a great resource in years past. Sometimes they have an legislative intern who writes up updates. There may be other groups that you're part of that provide updates. I think, it's important to pay attention to the source. When you're talking about federal policy, especially if you're watching the mainstream media, you just need to be aware that there's bias in, any media outlet. I try to listen to several different outlets on an issue and understand that the real truth is probably somewhere in between those messages. And then, contact your representatives and senators, your city council members. When an issue arises, an easy entry point is to send them a message. As you have more of a relationship, you can pick up the phone or text them or whatever you have the ability to do. But pretty low barrier to entry into advocating. All right, with that, my goal was to kind of do about 45 minutes and then leave some time open for questions. So I'm going to stop sharing and see what questions there are out there. You might all be stunned into silence at this point.
So this, Corey, thank you so much. And just a reminder to all, feel free to unmute yourself or to please put questions in the chat if you're not able to.
Got the question about whether the slides will be available. I'm happy to send these slides to Desmond and perhaps he can share them with the group.
Absolutely. Thank you, Corey.
I don't know if I have it. I'm just kind of thinking through this, and thank you for this presentation. I'm somebody that spends a lot of time thinking of policy and is very interested in policy in my role as a social worker, working in this space. And it seems to me, and I want to be very careful how I choose my words, it seems to me we're in a space right now that is very aggressive against the principles of public health, just foundationally, and kind of and supporting the community in general. And so I think I've been thinking a lot about how to be most effective in times that are very constrained. So I appreciate your messaging around, like, here's what it looks like to a conservative audience versus a more progressive audience. But are there policy initiatives, things that are resonating with this group right now that we really can kind of like hang our hat on, rather than just, because I think we see a lot of losses working in this space, and so I'm trying to think where the wins might be.
Yeah, really, really good observation. I do think we're still dealing with some of the emotions that came from the COVID, pandemic, public health restrictions. I mean, we're still seeing legislation having to do with that, and sort of rendering verdict on how the pandemic was handled. So there's just a reality of the emotions of some of that. I would say that we are starting to gain some ground in, just the Medicaid expansion. We've got a lot of new legislators this year, legislators who were not in office when Medicaid expansion was passed by the voters, by a voter initiative in 2018. It was then, implemented at the beginning of 2020, right as the pandemic was starting. And so what they hear is Medicaid expansion has cost more and there are more people on it than were forecasted, and the state can't afford it, and it's going to take away funding from public education and yada, yada, yada. The reality is the timing of when it was implemented, yes, the enrollment was higher during the pandemic because people had changes in their job situations. Thank God, because then they had access to see a primary care doc or whatever. They had access to care. The average length of time nationally that somebody is on Medicaid is 9 months. And so the rhetoric around if somebody gets on an entitlement program, they're never coming off, that is somewhat unfounded. And we're, right now, I would say what we're gaining ground on is just educating a lot of these new people on the facts around Medicaid. And that doesn't get into science, like public health stuff. If you're talking about vaccination policy, that is a huge area that is extremely vulnerable, and Idaho is not in a good position from the get-go as far as our immunization rates and whatnot. We've got a tough road ahead when it comes to vaccination policy. I think when it comes to Medicaid, we've got a chance to be able to emphasize the importance of having this coverage available, the spending at the state level, the enrollments come back to where it was projected to be, kind of, hit a peak over the COVID timeframe and has come back down where it was projected to be. The state portion of the funding has remained stable. And really what they're complaining about is they just don't like the program. So I think it's important to emphasize where there are stories of people that being on Medicaid helped get them through a tough time, and then they got a job where they made more income and they have insurance provided through their employer now, or they're on the exchange now, or whatever. I think where we have room is when we can provide stories. And something like that is hard with immunization policy, because the story is when we don't have an outbreak. It's less of a personal individual story, whereas an issue like Medicaid expansion or programmatic examples where you can provide examples of people and how that policy has benefited them.
Thank you, Sheila, for that question, and thank you, Corey, for just a comprehensive response. And if I may, I would like to pose a question. I just to uplift this to our audience here. I mean, I can't imagine a better, I don't want to even say introduction, but a better toolbox for engaging legislators than what we've heard here today. I've been working with them for over 10 years, and I wish I had someone with either just a fragment of the expertise that you shared today would have made my job a whole lot easier. I just want to uplift a few things that you've stated after engaging with them. The importance of having a clear ask. I can't uplift that enough. You have some people, they want to just rant and rave or just have this, spiel, but, and you even highlighted having a specific bill number. I mean, coming to them with I want you to do X, Y, and Z on bill A, B, and C. That is, tremendous. Also, just what you just stated, the impact of personal stories. I can't stress it enough. We're epidemiologists, we're biostatisticians. So you come in here with this, hey, well, we did this study, it's impacted based on 100,000 people. They don't care about that. They just want that one person. And believe it or not, just everything that you're stating is true. Also just want to, if you can, Corey, if you just speak about the power of money. You mentioned about money coming in from out of the state, but also just uplifting the fact that at least at the state level, I'm looking at data from the National Conference of State Legislators, NCSL, the average state legislator salary is about $43,000. In Idaho, it's even less. It's $19,000. Right. If you can speak to the impact, I don't think a lot of people are aware of that, just the impact of that salary versus lobbying and those out-of-state dollars and just that whole dynamic.
Yeah. So financially, I would say, the legislator salary is not why someone chooses to go into the Idaho, state house. Usually I try to, trust in goodness of intentions of people. And my personal challenge that I've tried to lean into is trying to understand where somebody who's opposing me on an issue, where that perspective came from, and trusting that it comes from an honest place, just like my perspective does. A different background, a different upbringing, different circumstances, different part of the state, trusting that they don't go into it for the salary. The salary basically kind of provides a housing stipend. Many of those legislators are coming to Boise and getting an apartment during the session. And so, that helps to pay for their food and lodging, mostly, not a whole lot else. Where the money really comes into play is election finance. So, organizations providing them contributions that will help with their next election campaign, that money talks. So, as working for a nonprofit, I don't have the ability to throw a bunch of money into their election coffers. So I have to be aware that money might be at play elsewhere. But we're also a member of the Idaho Hospital Association, representing all the hospitals in the state, and they have a political action committee that does do a fundraiser, and they do, as that political action committee, make contributions to candidates who are more favorable, or will at least listen on our health policy issues. And so it is important to know, and I think, helpful to go in and look at, the Secretary of State that we have now is a total data nerd. And he very, he's quick to brag on that, that he's a data nerd, and he's put a whole lot of cool resources on the Secretary of State's election page, where you can look at the dynamics of how our electorate has changed, that the in-migration to the state is mostly people that are super conservative now from California, Oregon, and Washington. The governor called them cows the other day, California, Oregon, Washington being the acronym. So, it's important to know that there are forces from outside the state that are helping to drive some of these issues financially. To the first point that you made, Desmond, the dynamics ideologically against public health right now are kind of you've got the individual freedoms. So the focus on me as an individual and what I have the right to do, what I have the freedom to do, what I have freedom from, that sort of thing, the individual versus collective groups. And so I think the challenge for public health is to try to shift the discussion, and for us in Catholic healthcare, same thing, trying to shift the focus back to our responsibility to one another. That is not discussed as much, and I think it's important for us to try to emphasize to a lot of these folks, many of whom, have faith-based backgrounds themselves, to remind them that, it's important for us to care for the common good as well. And, yes, freedom is great. It's great that we have the ability to do what we can do, but we also need to remember when our actions affect other people.
Could not have said it any better. Thank you very much, Corey. Do we have any final questions before we conclude? All right, hearing none. Thank you all today, and just a very, very special thank you to you, Corey. And we will be obviously we will hosting the presentation on our website, but we'll also share those specific slides out to the audience. It's absolute gold, and I can just, from personal experience, can attest to everything that you heard here. You have consultants being paid several $1,000s an hour just to hear a snippet of this. So this was definitely a treat. Thank you all. You'll receive the slides and video of the presentation made available, and we will see you again next month. Thank you. Enjoy your afternoon.
Thank you all.
Okay.